Hello, Medicos. Good day to all of you. This is Dr. BK for you, and in today's session, I am going to discuss about the fourth ventricle. Now, our learning objectives today with respect to fourth ventricle will be mainly on a short introduction about the fourth ventricles. Then we will be discussing in detail about the boundaries or the walls of the fourth ventricle, then about the cavity of the fourth ventricle, followed by that the recesses of the fourth ventricle, and then about the choroid plexus, and finally we will conclude today's session with the clinical aspects. Now, first to the introduction, ventricles of the brain. So the ventricles of the brain, or it is also called as the ventricular system, is mainly made up of a pair of two lateral ventricles. Then you have a third ventricle, and then you have a fourth ventricle. Now, the ventricles are the places where the cerebrospinal fluid is formed. Okay, so how actually the cerebrospinal fluid is formed? It is nothing but the fluid which is filtered from the capillary plexus. So the capillary plexus project into the fourth ventricle along with the pia mater, and that is called as the tela choroidea. Okay, so that is called as the tela choroidea, that double layered pia mater. So this is common for all the ventricles. Now, the CSF, which is actually produced inside the ventricular system, has to reach the subarachnoid space. So that mainly takes place in the fourth ventricle. So the CSF escapes into the subarachnoid space mainly through the fourth ventricle. Then you know very well the whole of the brain is actually bathed within the subarachnoid space, that is the CSF, cerebrospinal fluid. Now the CSF also has to be continuously replenished. So for that what happens is the arachnoid matter has villi which are actually project into the dural venous sinuses, and from there the CSF escapes into the venous system, and finally through the venous blood it reaches the heart. Okay, so with respect to the arachnoid villi and arachnoid granulations, I have already discussed in detail in the meninges of the brain. So with respect to the introduction to the new neuroanatomy, and not only that, in the head and neck session, in the dural folds and dural venous sinuses also I have mentioned. Now coming to the fourth ventricle, so it is actually a cavity of the hindbrain, so which is situated between the structures developed from the hindbrain, that is a medulla pons, which is present in the front, and the cerebellum, which is present posteriorly. So it is present in front of the cerebellum and behind the pons and the medulla. So that is the situation. In the posterior cranial fossa, in the infratentorial compartment, you can actually mention if you want all these things. And if you look carefully, the fourth ventricle is mainly or intimately related to the cerebellum, especially the vermis of the cerebellum. So only in the previous class we have discussed about the cerebellum in detail. So the two cerebellar hemispheres and the midline structure called as the vermis and the subdivisions of the vermis. Now, so that is you are able to see the fourth ventricle is actually highlighted, and the cavity of the fourth ventricle which you are seeing in a sagittal section. So it mainly presents a roof. So here you are able to see that is the roof of the fourth ventricle, that is in the form of a tent shaped. So you are seeing the how the tent is formed, no? That is how. Only thing, the tent here, it is tilted instead of lying above like this. It is actually tilted. So then you have a roof. Opposite the roof, you have the floor of the fourth ventricle. So there are numerous features which are seen on the floor of the fourth ventricle. Then you have the lateral walls. So you have the lateral walls of the fourth ventricle. So within this roof, floor, and the lateral wall, what is present is the cavity of the fourth ventricle. Okay, and this cavity, what happens is also extends sideways and posteriorly, and that we call it as the recesses of the fourth ventricle. Okay, that we call it as the recess of the fourth ventricle. Now if you look at the cavity of the fourth ventricle, it extends above, or it is, the cavity is actually continuous with the another narrow passage which is called as the cerebral aqueduct. Okay, so that is actually called as the cerebral aqueduct, which is the cavity of the midbrain. So you're able to see the anterior part of the midbrain, the crus cerebri, and posteriorly you are able to see that is the tectum, forming your superior colliculus and the inferior colliculus, and you see a narrow passage here that is called as the cerebral aqueduct. Okay, so this cerebral aqueduct connects your fourth ventricle with the third ventricle. So the third ventricle is actually a cavity of the diencephalon. Okay, so if that is the case above, inferiorly what happens is the cavity is continuous with the lower part of the medulla and the spinal cord. The cavity of the lower part of the medulla and the spinal cord is the central canal. So the central canal, extends throughout the length of the spinal cord, and beyond that also, since the meninges extends, there is a free flow of CSF below the level of the spinal cord. So the spinal cord ends at the lower border of the L1, and beyond that there is actually free flow of CSF within the meninges, and it is used for so many diagnostic procedures, especially at the L3 level, where the lumbar puncture epidural block is performed. So all this again we have discussed in detail in the spinal cord session itself. Now coming to the boundaries. So the first boundary we will discuss with respect to the fourth ventricle is the lateral wall of the fourth ventricle. So the lateral wall of the fourth ventricle is mainly as a superolateral part formed by the superior cerebellar peduncles. So here you are able to see, and this is mainly your middle cerebellar peduncle, and that is your superior cerebellar peduncle. So that mainly forms the lateral or the superolateral wall. So the inferolateral wall is mainly formed by the gracile and the cuneate tubercle and the inferior cerebellar peduncle. Okay, so here you are able to see the superolateral wall is mainly formed by the superior cerebellar peduncles, so which is actually extending from the midbrain. So near to the midbrain they converge, they are forming the roof. Okay, but as you trace it laterally, they are forming the lateral wall of the ventricle. Upper lateral wall of the ventricle is mainly formed by the superior cerebellar peduncles. Okay, then the inferolateral wall is mainly formed by these two structures you are able to see here. The medial one is the gracile tubercle and the cuneate tubercle, and more laterally you see that is your inferior cerebellar peduncles. So from medial to lateral, the inferolateral wall is mainly formed by the gracile tubercle, cuneate tubercle and the inferior cerebellar peduncle. Now coming to the roof, it is actually tent shape, and as I told you in the beginning itself, the roof has got two parts. So the upper part and the lower part, and both meets at the apex. Okay, so the roof has got a upper part and a lower part, and both meet at the apex. Okay, now actually coming to the roof in detail, we will see about the roof of the lateral ventricle. Now, you are able to see the upper part of the roof. There is a membrane which is stretching between the two superior cerebellar peduncles, and that is called as the superior medullary velum. So, what is piercing the superior medullary velum is the trochlear nerve. So, the superior medullary velum forms the roof, and you should also remember that to some extent the superior cerebellar peduncle, as they converge near the midbrain, also contributes to the upper part of the roof. You are able to get an idea. So this is actually the upper part of the roof and the lower part of the roof. We have seen it in the sagittal section. So that is the superior medullary velum. If you trace the medullary velum, it will extend into the core of the white matter of the cerebellum. So inside the white matter, core of the white matter, you are able to see this is all the deep nuclei of the cerebellum, mainly your dentate nucleus, the largest nucleus. Okay, so along with the superior cerebellar peduncle, the medullary velum also extends into the core of the white matter, and inner part of this velum will be lined by ependyma, because the interior of any ventricle will be lined by the ependymal cells. So they are again a type of neuroglial cells. They are a type of neuroglial cells. Superior medullary velum. Next, coming to the nodule is actually related to this part of the roof. So here you are able to see the cerebellum, upper surface of the cerebellum. Now we are able to see the lower part of the cerebellum, and that is the cavity extending. You are able to see that, and this is your tonsils. Okay, most medially you have the tonsils. The vermis you are able to see from above, it folds on below. So it has folded on below and it forms the nodule, and lateral to the nodules what you see is the flocculus. So flocculonodular lobe is actually seen in a separate color here. You know, this forms the archicerebellum. Okay, and the remaining anterior lobe is shown in a different color, which forms your paleocerebellum, and the remaining is your neocerebellum. So let us not go into much details of it. So in this place, when you look at it, the roof, the inferior part of the roof all extends. So the nodule is actually related to the inferior part of the roof. So this superior part of the roof and the superior medullary velum, from anteriorly it has come and extended. Now the inferior part of the roof, you are able to see the nodule is related to this part of the roof, and a small structure, the inferior medullary velum, can be seen extending, okay, with the white matter, and it forms a free edge that forms the peduncle of the flocculus. That free edge of the inferior medullary velum will form the peduncle of the flocculus, and that also merges with the white matter. So this core is actually will form the white matter. Okay, and the deep cerebellar nuclei will be situated. So as I told you, the inferior medullary velum forms uh, the peduncle of the flocculus. Now some books refer that the whole inferior part of the roof, is formed by inferior medullary velum, but that is not the case. Only a small area near to the nodule is actually formed by the inferior medullary velum. So mainly the roof is actually formed by the, what we have seen is the membranous superior medullary velum, and the inferior medullary velum and lower part of the roof. So the lower part of the roof is actually a non-nervous structure. It is membranous, mainly formed by the ependymal cells and double layered fold of the pia matter. Only that forms. Only near to the cerebellum you have a very small inferior medullary velum which will be related to the nodule. Okay, so as I told you, the lower part of the roof is formed by non-nervous tissue made of ependyma and a double-layered fold of pia matter, which is called as the tela choroidea. And you are able to see this fringe-like structures within the cavity is your choroid plexus. Okay, so we'll come to the choroid plexus later. So the membranous part of the roof, as I told you, this part, the formed with an ependyma and the tela choroidea merges with the inferior cerebellar peduncle as you come laterally. So as you come laterally, what happens? It merges with the inferior cerebellar peduncle, and in this lower part of the roof, in the midline, you see an opening, and that is actually the median aperture or foramen of Magendie. So the foramen of Magendie is a median aperture which you see in the lower part of the roof through which the CSF escapes, and you are able to see there is a large collection of CSF in this place called as the pontomedullary cistern or the cisterna magna. Okay, so here you have the pontomedullary cistern. So here you have cisterna pontus. Here you have the interpeduncular cistern, and here you have your tectum system related to the tectum. So numerous cisterns. So again, a lot of information about the systems and its communications we have already discussed in the uh, meningeus class of the introduction to neuroanatomy. Okay, so here you are able to see that the inferior part of the roof will merge with the inferior cerebellar peduncle. Will merge with the inferior cerebellar peduncle. Okay, and then this part of the roof also extends laterally. So you are able to see that lower lateral part of the roof also extends laterally into the recess. So that means this inferior part is actually this membranous structure is also going to form a boundary for the lateral recess, which is an extension of the cavity of the fourth ventricle. Okay, so which is an extension of the cavity of the fourth ventricle. So we'll come to it later again when we deal with the cavity of the fourth ventricle. So now coming to the mainly the floor. So a lot of features we come across in the floor. It is also called as a rhomboid fossa. Why? Because it is a union of two triangles and it is rhomboid in shape. So the upper triangle is mainly formed by the lower part of the posterior surface of the pons, and the lower half of the roof or the lower triangle is mainly formed by the posterior surface of the upper part of the medulla. Okay, so two triangles opposing each other. Okay, so the junction of these extends as the lateral recess, which we have already seen, upper part of the floor and the lower part of the floor. If you trace it laterally, it passes as the lateral recess between the cerebellum behind and the inferior cerebellar peduncle anteriorly. Okay, so at the junction of this upper and lower part of the floor, you are able to see this structure, band of fibers. They are called as the stria medullaris. So what is stria medullaris? They are the posterior external arcuate fibers. So again in the medulla I have discussed about this. So posterior external arcuate fibers, mainly they are from the arcuate nuclei. So arcuate nuclei are displaced pontine nuclei from the pons. They have just displaced, come down to the medulla. They are seen in the anterior most part of the pyramids of the medulla. So fibers from the arcuate nuclei also enter the cerebellum, mainly through the anterior external arcuate and the posterior external arcuate fibers, which is passing via the superior inferior cerebellar peduncle into the cerebellum. So that is the band of white matter. You are able to see that the stria medullaris, which is nothing but the posterior external arcuate fibers. So the rhomboid fossa or the floor is outlined for you. So you draw a drain in the middle. You get one triangle which is apex facing upwards and other triangle where the apex is actually facing downwards. So coming to the features on the floor of the fourth ventricle. So what are the features on the floor of the fourth ventricle? Mainly in the midline, you are able to see a sulcus which is called as the median sulcus. Okay, so it is actually called as the median sulcus. It is not medial. Kindly excuse for that spelling mistake. So it is actually the median sulcus. Then on either side you see a raised area that is called as the median eminence. That raised area is actually called as the median eminence. The median eminence is bounded laterally by another sulcus or line which you are able to see here, that is called as the sulcus limitans. Okay, so that is the sulcus limitans which you see on the either side. So first what we saw is the median sulcus. This eminence is the median eminence, and more laterally what you see is the sulcus limitans. Then lateral to the sulcus limitans, this whole area is the vestibular area. You are able to see. So that is the vestibular area. So the vestibular area actually extends even in the upper as well as the lower part of the floor. That means it is divided between the pons as well as the medulla. So the vestibular nuclei, medial and the lateral vestibular nuclei is actually situated deep to this vestibular area, and you trace more laterally, you can see that extending as the auditory tubercles. More laterally actually it extends as the auditory tubercles. Then above you are able to see a slightly darkish gray or something like that, and that area is actually called as the substantia ferruginea. So it's also called as the substantia ferruginea, or the other name for it is the locus ceruleus. So deep to the locus ceruleus you have the nucleus ceruleus, and that area it mainly comprises of noradrenergic neurons. Okay, so it is mainly formed with non-adrenergic neurons. It is also called as substantia ferruginea because that part is actually somewhat bluish gray in fresh specimens due to the abundance of the pigmented area. Then if you actually trace this sulcus limitans, it bulges more laterally, forming two swellings in the lower part of the pons, and that is called as the facial colliculus. So that also in detail we have discussed in the pons. So this bulge or the facial colliculus is mainly formed by the facial nerve fibers arising from the nucleus of the facial nerve winding around the abducent nucleus. So the facial nerve nucleus, they make a turn, wind around the abducent nerve nucleus, that forms a bulge, and that winding of the facial nerve nucleus around the abducent nucleus is also represents the internal genu of the facial nerve. So because within the nervous tissue within the pons it is making, so it is also called as the internal genu, that winding of the facial nerve fibers around the abducent nerve nucleus. Okay, then what other features you come across? The superior fovea is actually a small depression in the lower part of the sulcus limitans. So here you are able to see the sulcus limitans. Here you see a very small depression called as the superior fovea. So we will do these. We are actually continuing with the floor structures. So the features on the floor. So in the lower half of the floor, what you see, mainly coming to this medulla part, lower part of the floor, inferior fovea. So that is a small triangular depression is actually called as the inferior fovea, and immediately above that only you see the superior fovea. So in the lower part of the sulcus limitans, okay, so that area will be the superior fovea. Now from the inferior fovea you can see a sulcus running downwards. So from the inferior fovea, you can see a sulcus running downwards and dividing this part or the posterior surface floor of the fossa into a medial hypoglossal triangle. So here you're able to see the medial hypoglossal triangle and a lateral vagal triangle. Okay, so medial hypoglossal triangle and then lateral vagal triangle you are able to see there, and more laterally of course this will be your whole area is your vestibular area or triangle, vestibular trigone. So trigone refers to the triangle. Okay, then lateral to this vagal triangle, so deep to the vagal triangle what you have is the um, dorsal nucleus of the vagus. So lateral to the vagal triangle you have this area which is called as the area postrema. So you have highly modified neuroglial cells there, area postrema, and the area postrema is present between the vagal triangle and the gracile tubercle. So very small area, and it is separated from the vagal triangle again by a band of white matter called as the funiculus separans. Okay, funiculus separans. Then if you come lower part, so this is actually your inferior angle, whereas that is your superior angle, is called as the obex. Okay, so it's called as the obex, and you are able to see the thickening of the lower part of the roof, and that ependymal thickening you are able to see as a ridge, and that is called as the tinea. Okay, tinea means tape like. So you can able to see a ridge extending from the obex, or other books describe this two tinea converge at the obex, vice versa. Okay, so the inferior angle is also called as the obex, and this is actually called as the tinea, the white ridge which you are able to see here. Then if you look exactly the lower part of the roof, it will represent the nib of a pen. So your fountain pen, no, ink pen, it represents the nib of a pen. So that is why it is called as calamus scriptorius. So calamus scriptorius means it is representing like the nib of a pen. Okay, so now coming to the cavity of the fourth ventricle. So with respect to the cavity of the fourth ventricle, as you know, it is actually filled with CSF. So CSF is produced by the choroid plexus, which is present or projecting into the cavity of this fourth ventricle. So at the superior angle, the cavity is continuous with the cerebral aqueduct or aqueduct of Sylvius or Iter, which is a narrow cavity of the midbrain. At the inferior angle, you are able to see it is continuous with the canal, the central canal of the spinal cord. The central canal of the spinal cord. So these are all the areas. What you see is how the CSF is actually circulating. So that is what is shown here. So how the CSF is circulating. The various arrows represent how the CSF is circulating in this picture. Now, what are the extensions of the cavity? So they are actually called as the recesses. They are actually called as the recesses. So mainly you are able to see the cavity is extending laterally. Okay, same way it also extends little bit dorsally and also dorsolaterally. So the extensions of the cavity laterally is called as the lateral recess. Okay, a pair of lateral recess you have, and then you have one median dorsal recess, and again a pair of two lateral dorsal recess, one median dorsal recess and one lateral dorsal recess. Now first we will try to understand the pair of lateral recess. So if you look at the pair of lateral recess carefully, this area is the lateral recess extension of the cavity. What is present behind is your flocculus. So, and flocculus is present actually behind. In front, what you see is the inferior cerebellar peduncles. Okay, so this should be your superior cerebellar, this should be your middle cerebellar, this is your inferior, this is your superior medullary velum, forms the upper part of the roof. Whereas the lower part of the roof, you are able to see it is a non-nervous membranous structure. Non-nervous membranous structure formed by your ependyma and the tela choroidea. And as you see, this is extending also laterally, lower part of the roof. And in the lower part of the roof, we saw a midline aperture or opening, and that is called as the foramen of Magendie, through which the CSF escapes. CSF escapes through three openings, one median opening which you are able to see here. So now coming again to the cavity extension, laterally it extends between the flocculus behind and the inferior cerebellar peduncle, a pair of lateral recess. So if you look at the end, at the lateralmost end of the recess, you are able to see this opening, that is called as the foramen of Luschka. So it is actually called as foramen of Luschka. On either side you have. So on either side you have the foramen of Luschka, and again through that the CSF escapes into the subarachnoid space. So you have one foramen of Magendie and you have two foramen of Luschka, and you are able to see the choroid plexus is entering into the cavity via this lateral opening. The choroid plexus is actually entering into the cavity via this lateral opening. So that is about the lateral recess. So median dorsal recess. So here you are able to see that is your fourth ventricle, and the lateral extension as the lateral recess we have seen here, inferior peduncle and the flocculus will be here. Median dorsal recess. This is your lower part of the floor and that is your upper part of the floor, and that is your apex. So the cavity extending dorsally in the midline, you are able to see that is the median dorsal recess, and extends into the white matter. Of course, obviously you are able to see the white matter, and this part is situated above the nodule of the vermis. Then on either side of the median dorsal recess, which is not shown in this picture, is on either side above, on that side and this side, right and left, you will be able to see a pair of lateral dorsal recess. Okay, so the lateral dorsal recess. Okay, so the median dorsal recess is present above the nodule of the cerebellum, and on either side of the nodule of the cerebellum, you see the lateral dorsal recess. So openings, one opening, the median aperture foramen of Magendie in the lower part of the roof, which we have seen here, and the next opening I have shown in the last picture, the foramen of Luschka. So here also the foramen of Luschka, two lateral openings. Okay, in the lateral recess, lateral most edge, you have seen that, and the choroid plexus actually projects or enters the ventricle through this lateral recess, opening in the lateral recess, that is the foramen of Luschka. Yes, so here you are able to see through this lateralmost opening foramen of Luschka, the choroid plexus is entering, and this is your one median recess and a pair of two lateral recess. Okay. So this bulge you are seeing is the floor of the fourth ventricle. Most probably that should be your facial colliculus. So next, coming to the choroid plexus of the fourth ventricle. So how actually the choroid plexus is formed? So for that, first we should understand what is stela choroidea. So it is a double-layered fold of pia mater. So here you are able to see from the lower part of the roof a double-layered fold of pia mater, that is actually called as the tela choroidea. So it will have one layer anteriorly and one layer posteriorly. So the posterior layer will be intimately applied to the cerebellum and extending, so that is all the pia mater extending into the grooves. So this pink color one will form the posterior layer of the tela choroidea, the dorsal layer. Now the posterior dorsal layer which lines your cerebellum, okay, or the vermis. So this is your midline vermis which will line the vermis, as I told broadly, as the cerebellum. On reaching the anterior part of the nodule, what happens is it is reflecting as the anterior layer. You are able to see that. So that is the tela choroidea, a double layered fold of pia mater. So if you trace this pink color one, don't try to see this fringed area, that is choroid plexus. This one intimately a pia mater will be related to the surface of the vermis. Then it will reflect as the anterior layer. Okay, so double layered fold of pia mater forming the tela choroidea. You're able to understand. Okay, and then what happens is laterally, if you trace the dorsal layer, naturally it will form continuous to the pia mater of the cerebellum, and the ventral layer will actually line your pia mater of the medulla, mainly your inferior cerebellar peduncles. So between these two layers only the the choroid plexus projects. Now the ventral layer, of course, here you are able to see the upper part of the roof and the floor. All this is lined internally by the ependymal cells. So this is your superior medullary velum will be lined by ependymal cells. So this is your lower part of roof membranous structure bound by ependyma and this tela choroidea. The floor again will be the so many rhomboid fossa structures we have seen, all will be lined by the ependyma. You are able to see that. So next, yes. So what forms the choroid plexus? So you are able to see this is the part of the vermis, and the tonsils have been retracted. Now you are able to see the inferior medulla. So the posterior inferior cerebellar artery is actually projecting as the choroid plexus into the cavity. Okay. So choroid plexus is mainly formed by the pica, posterior inferior cerebellar artery, so which is going to supply the under surface of the cerebellum. You are able to see that. So the inferior medullary velum has been cut open, and you are able to see that is the choroid plexus, which is mainly formed by the posterior inferior cerebellar artery. This is your obex, as I told you, and that should be the tinea. That white ridge should be your tinea, and see how the choroid plexus is projecting. So now you are able to see that is the choroid plexus, which is formed by the posterior inferior cerebellar artery. Okay, so now the plexus, as I told you, it is present between the double layered fold of pia mater called as the tela choroidea. It is T-shaped. So you are able to see it is T-shaped with a vertical limb and a horizontal or a transverse limb. So a pair of vertical limbs. No, because one posterior inferior cerebellar artery and other posterior inferior cerebellar artery giving rise to this choroid plexus. Okay, so this plexus, what happens? They have a vertical limb on paramedian on either side of the midline, and then you have a pair of horizontal limbs. So you're able to see that a pair of horizontal limbs. Okay, and that actually enters via the lateral apertures, or vice versa. You can tell it extends up to the lateralmost end of the lateral recess where the foramen of Luschka is present. So the choroid plexus, as I told you, it is a capillary plexus, and naturally it is not directly entering or directly related to the cavity, because the cavity is lined by the ependyma. So if you look at these choroid plexus, mainly it has numerous finger-like processes called as the villi, and even electron microscopic view, you look, they also have microvilli. So slowly what happens, from the capillary plexus blood, the CSF alone is actually filtered. So it is more like your lymph. So it is considered as the no lymphatic system in the CNS. So it is considered as a lymph. So mainly the interstitial fluid is slowly escaping as a CSF and secreted into these ventricles. Okay, so the choroid plexus mainly formed by the posterior inferior cerebellar artery, and it is present in the form of T-shaped. So one vertical limb and the two transverse limb you are able to see here. Okay, so now coming finally to the clinical aspects of the fourth ventricle. So first commonly what you see is the Arnold-Chiari malformation. So what is actually Arnold-Chiari malformation is the tonsils of the cerebellum, which you are able to see here. The tonsils of the cerebellum, they will herniate downwards. You are able to see they are actually herniating downwards. Okay, and along with the medulla, so through the foramen magnum, they are trying to herniate downwards. It is a congenital malformation. So here they are trying to decompress it. It is a so, okay. They are trying to decompress through some surgical procedure, but because of this, you are able to see the lower part of the roof will be compressed. So when the lower part of the roof is compressed, so naturally it will block the median aperture and the CSF will not be able to escape. The CSF will not be able to escape from the ventricles into the CSF. So naturally the ventricles will become very much dilated. Okay, and not only that, because of that the CSF also gets accumulated within the subarachnoid space, leading to congenital hydrocephalus. Okay, so hydrocephalus, you can see baby with a large head. Okay, so you're able to see the CSF is completely blocked, and there is actually the CSF is actually accumulated within, and it leads to increased intracranial pressure. So the increased intracranial pressure slowly might compress the nervous tissues, and it might lead to so many complications. So that is called as the Arnold-Chiari malformation. Next is your medulloblastoma. So they are actually primary cancers affecting your cerebellum. So mainly around the CSF or your fourth ventricle and the cerebellum affects the children, and anywhere between the first year, uh, it can affect the children. Medulloblastoma, so tumors, you are able to see the medulloblastoma. So again it will compress your nervous structures and your fourth ventricle, leading to hydrocephalus. All the cerebellar symptoms will be present, mainly vomiting, especially in the mornings. You can see vomiting and migraine headache. Initially it will be looking as if some gastrointestinal disorder, but slowly other symptoms sets in. So hypotonia will be there, truncal ataxia will be there, the child will fall down very frequently, then nystagmus will develop. So all the cerebellar symptoms tend to appear. Primary cancers called as the medulloblastoma, tumors affecting the cerebellum, also compresses your fourth ventricle. And the survival rate, if you look at it, below 5 years, the survival rate is higher, slightly above 60%. But as it proceeds from 10, 15 to 20 years, the survival rate also decreases. The next area, postrema. Before that, I also want to actually inform one more syndrome, which is called as the Dandy Walker syndrome. So this is also affecting mainly your cerebellum and your fourth ventricle. Cystic swellings of the fourth ventricle you see in the Dandy Walker syndrome. So area postrema, so mainly made up of specialized ependymal cells. It is also your vomiting center. So this I have already shown in the floor of the fourth ventricle, the area postrema. Mainly consists of specialized neuroglial cells, and it is also called as the circumventricular organ. Area postrema is also called as the circumventricular, means situated around the ventricles. Okay, so at this here we have seen the area postrema, the circumventricular organ situated around the fourth ventricle, and it is only the paired circumventricular organ. The other circumventricular structures are not unpaired or not paired here and seen on the either side, and mainly it receives the dorsal afferent fibers of the what you call the vagus. Vagal nucleus is there, so mainly from the GIT. So some neurochemical substances are actually present there, and it is mainly your vomiting center, and your respiratory center is also present there in the area postrema. Mainly it lacks the blood brain barrier. Okay, so that is about the area postrema. Okay, so I think which is highlighted for you, that is the area postrema. Okay, so with this I have completed the fourth ventricle, and thank you very much for your patient listening.